All right, hello English 365. My name is Trey Leger, and I am studying kinesiology at the University of Louisiana at Lafayette. And I will be presenting today to you about a new technology that is used in the field of physical therapy called the exoskeleton robotic suit. So this exoskeleton robotic suit is mainly used in rehab centers and labor-intensive facilities. The research that I'm going to be presenting to you will focus on all of the skeletons used in rehab centers like physical therapy centers, occupational therapy centers, inpatient rehab, and also nursing homes. So my first research started when I actually interviewed a patient. This patient actually suffered from a traumatic brain injury. He actually called it a noxy brain injury, which is just another word for a traumatic brain injury. I interviewed this patient to learn about his experience and progress. The specific patient actually lost all cognitive enhancement and broke his right femur. He began utilizing the robotic suit at Texas Rehabilitation Rehab. So I actually got in contact with the rehab center, and I was able to talk to the clinicians and the technicians who worked to get him into the suit and did the physical therapy sessions with him. So their main thing that they presented to me, they said the hips and knees and ankles are the main muscle groups worked for patients who are suffering for paralysis. So this patient did suffer from paralysis. He was paralyzed because of his traumatic brain injury. So when that happens specifically, it's really important to retrain your body to neurally muscular, re-educate like your bones and your muscles to move in the proper gait patterns or walking patterns. So the pelvic girdle rotations are very important as well. So they focused on that, and you can see on the picture that they have a pelvic strap, and it securely makes sure that all of your pelvis is actually strapped into that suit while walking in it, so you don't have posterior pelvic girdle rotation or anterior pelvic girdle rotation. All right, so in their physical therapy sessions, they mainly worked on walking patterns. That was basically their plan of care for the physical therapy patient. Without the suit, in the beginning, for the first 2 months, they said they used a gait belt, which is just like a strap that goes around the body to keep the patient securely with the physical therapist or the technician. So what happens before using the suit is they actually have to use the gait belt while walking with the patient. So the actual therapist and another tech has to be walking with the patient. So they call that moderately assisted patient. So the benefit of having the exoskeleton suit would be they don't have to use two people in their clinic to actually walk with the patient around the clinic to get them, through their activities. They would only have to use one person in the facility. So that's that's just one advantage to the suit. You're able to have a higher productivity rate in your clinic. The two common movements in the foot are called plantar flexion and dorsiflexion. Dorsiflexion is when you actually bring your toes towards your face, and plantar flexion would be when you bring your toes to the ground, like planting your foot. Pressing the gas pedal is what we use a lot. It's the analogy we use. So basically, when someone is suffering from a traumatic brain injury or paralysis or any neurological condensation, their body really can't understand how to plantar flex or dorsiflex. So the suit, you can see at the bottom, they have those ankle straps that will assist in those flexions. It will get them into dorsiflexion and plantar flexion very easily because it's mechanically forced. It has you can see we have a remote control for the actual suit, so it can be monitored and controlled by the therapist. So get them in that correct pattern. Okay, yeah, most commonly with traumatic brain injuries, they have more of a plantar flex foot. They don't have dorsiflexion. So they're probably going to use that remote control to put them more in dorsiflexion. Right after they're done using the robotic suit for about 6 months is what this specific therapist said, they will then progress to an ankle, let's see, I have the name right here. It is called an ankle foot orthotic, also called AFO. It's a very common brace worn by patients to get them, to walk properly, stand, be able to weight bear themselves, and have dynamic ankle ranges of motions. So another thing that they said they utilized was actually tying the foot into dorsiflexion, so they would pull up the foot and like strap it just to give it some more force. All right, so I will now talk about the responses that I received from the patient himself about his therapy. So he said that he was actually granted the honor of using this assisted device without payment at all. The actual payment for this device is $150,000. So that is a huge thing right there. He actually went to Texas Institution Rehabilitation Center. So it's a research hospital in Texas. So he was able to use the device free of charge. So that was great. That's the first thing that he told me. He actually really enjoyed using the exoskeleton suit. He said it wasn't his favorite part of therapy. There were other techniques and devices that they use. He did mention that they used an ergo trainer treadmill, which is actually very similar to this this suit right here. But instead of having just the lower extremities strapped in, it would have an upper extremity strapped in as well. So the patient would be lower body strapped in, upper body strapped in on a treadmill. It's actually a robotic device as well. The same company that I researched, Exobionics, made the same actual device, and a harness is actually strapped to the patient's head and connected to the ceiling to get that patient back into proper posture, balance, and get them in the correct form they need for their gait movement. So that's cool. He said that. And also the patient, we did have 3 different interviews. Our first interview talked about just his experience, like his normal day of physical therapy in this exoskeleton. So actually, he said it wasn't the best. He said it was actually pretty frustrating and actually hard to really grasp the concept. He actually really wasn't even cognitively there altogether. He was still having like some serious cognitive deficits at the time. So it was hard to answer the question if he felt like the suit gave him any progress. He did say that he actually think that the pivotal moment of his recovery was when he was transferred from Texas Texas Rehabilitation Center to Lafayette General, where he did continue doing therapy. He did not use the exoskeleton suit. He actually did a lot of seated exercises and a lot of stretching, and he was prescribed Ativan, which is basically similar to Ambien, the sleeping medicine. But apparently, so what he told me, the information that he received from his doctor, was that the Ativan, also called the Ambien, has an adverse effect on patients who have like neurological conditions like himself. So it actually gave him the muscle tone and all of the motivation and activation of all of the muscle groups he needed to begin his weight bearing exercises. He said 2 weeks after taking the Ativan was when he started actually bearing weight and doing like side lunges and like some squats. So that was great. And another form of therapy he said that he actually did partake in that was also better than the exoskeleton suit was the Botox. So that was cool. He did feel that the exoskeleton suit at Texas Rehabilitation Center did have some advantages. He could tell that the physical therapists themselves could actually watch him in his walking pattern. So when you don't have the exoskeleton suit, you probably need like 2 or 3 people there. Like I said, that's gonna require more productivity from your team. So it is gonna put more stress on the team that's working with him. So having the exoskeleton robotically and mechanically move his limbs for him and put him into those ranges of motions will give the physical therapist that's treating him the advantage of like actually watching him and giving him like the proper cues and like different techniques and tactics that he can use to increase his goals, to get to his goals. So yeah, but actually I did interview another patient about their experience with the exoskeleton suit, and they kind of had opposite response. They said they do feel like the exoskeleton suit was the pivotal moment of their therapy, and they would absolutely use it again. All right, so that's all I have. Thank you, English 365.